Okay, so basically there's three ways to use essential oils, right? You can use them aromatically, topically, or internally. So aromatically, very simple, just inhaling it out of your hand or inhaling it straight from the bottle. Oh, my mirror is kind of stuck. Whew, that smells good. Um, or in the diffuser. The second way to use essential oils is by using them topically, which we talked about already, diluting, don't put them in your eyes, these things. And the third way to use them is internally. So this is kind of tricky because you're pregnant and you want to make sure that what you're ingesting is safe for you and for the baby. So yeah, so like we read before, like avoiding cinnamon bark and clove and clary sage during pregnancy is highly recommended because those are kind of oils that will induce contractions. So you want to avoid those and avoid taking them. Even the like teas and foods that contain um, those kinds of herbs and spices, you want to avoid. Um, Let me think. So ingesting something like putting a drop of maybe even less than a drop, maybe even grabbing like a toothpick and just hold on, let me get something. Okay, grabbing a toothpick and just putting the stick on top of this little reducer in the oil and like something like peppermint or lemon if you're in your first trimester and you're having like discomforts that you have that are usual during your first weeks of pregnancy, um, and you just want to have something in your mouth to help you with that, lemon and peppermint would be good to do that with, or even a drop in your water. And obviously oils and water don't mix, so you'd have to like do one of these wine movements, which will be kind of nice because you really can't drink that much wine during pregnancy, so you'll feel nice. And another thing that I want to talk about is oils and lifestyle. So, one thing that I've noticed, and kind of like our modern day mentality, is that I show somebody an oil and they'll be like, "What is that for? What can I use that for?" And we go through the oils, and you want to know exactly what to do with this exact oil. Um, and it kind of is like this doctor or pharmacist patient relationship that we're kind of used to. Like the doctor, you tell the doctor your symptoms, he gives you a diagnosis, and he gives you a prescription, and he tells you take this for this amount of times, and it's like a specific thing, right? But natural medicine doesn't work like that. Natural alternatives do not work like that. When you're thinking about holistic medicine and holistic health, you're thinking about a variety of things, and you're not just treating a symptom. You're helping a whole lifestyle change to help yourself and your body, mind, soul, spirit, environment, everything. So with the essential oils, I want you all to keep in mind that what we're going to talk about, if it doesn't ring true to you about that specific oil that I spoke about, you can go and check what other oil that you feel more inclined to use that'll work for you, your individual person and body. And that way you can have the experience that you need to have with that essential oil for whatever it is that you need. Um, that being said, when people ask about different things, like, I don't know, it's this season of everybody getting respiratory issues and their immune system dropping and all these things, it's like, what oil can I use for that? What can I do for this or that? So I can recommend different oils, and we can look things up and find different oils, but it also involves you taking a look at your lifestyle, what you're eating, what you're doing, your daily activities, your daily thoughts to yourself, your daily beliefs that may also be contributing to this drop in your immune system that is allowing for viruses to take over. That may be your diet is poor, that may be you may be going through an emotional stress at home or at work, or trauma, whatever it may be. So take a look at all of this in a holistic way, and make that message, what I'm giving you, individual to your specific needs and where you are at in your life right now.